welcome to ONCOLife interview session. I am delighted to be joined today by Lorna Warwick, CEO of the Lymphoma Coalition. You are welcome.
Thank you very much for inviting me to talk to you today.
Thank you so much for joining us today. In this session, we will talk about the patient perspective on CAR T-cell therapy that has transformed the outlook for blood cancer patients, but still remaining out of the reach for far too many patients. We will also focus on barriers patient and caregiver faced. So we may start with some information about your professional journey and about your background.
So I've been CEO of Lymphoma Coalition for about 6 years, but I've been a patient advocate in the hematology space for over 20. So a long time working in this area, and actually my professional degree is in education. So I love helping people understand more about their disease and the treatments that they potentially can have, as well as understanding the other things that come with having lymphoma, whether that be the psychosocial aspects, any barriers, and helping people navigate through. It's my privilege to work in this space. And what I love about being part of Lymphoma Coalition is I get to work globally with patient advocates around the world, but also we collect a lot of patient experience data. So we get to look overarchingly about what the barriers might be for patients, what that experience is like in clinic, and how we can best support them moving forward and improve care.
The CAR T vision emphasizes patient autonomy and choice. From the patient's perspective, what are the most common barriers they face when trying to access the CAR T-cell therapy?
So when accessing therapy, there are differences depending on where patients live, for sure. The number one issue that patients face, truthfully, is never being told that CAR T might be a choice for them. So are they actually having that conversation in clinic with their doctor that CAR T might be a great option for them? And then if they get past that barrier and they actually have this as an option, it's really understanding what the side effects potentially might look like, as well as navigating through some of the logistical issues that come with having CAR T. This might include figuring out, do I have a care partner who's willing to be with me every step through this experience? Do I have the ability to leave my job for an extended period of time, and my care partner also potentially leaving their job? What's that going to look like? Can we handle the financial burden? Sometimes the administrative burden, getting approval from insurance companies or others so that the costs of the treatment are covered can be problematic. So there are so many different barriers that could potentially impact a patient being able to fully to have this as an option for them, and making sure that they're making the right choice based on good information. There's all kinds of information out there about CAR T. Some of it is good, some of it is not so good. So making sure patients are getting to the right resources to understand what treatment is like right now, now that we've learned more about CAR T and how to best manage patients through this treatment option.
Well, in one of your statements, you said that the patient must receive culturally sensitive, evidence-based information. And what are the current gaps in the patient education around the CAR T-cell therapy, and how can this be addressed?
For most patients, eventually they find good information that works for them, but it takes some digging. Part of the problem is that they're not often given a roadmap in clinic that points them to other sources of information. Clinicians or their nurses within the hospital themselves often provide some information, but most patients find it lacking. So they go, 90+% of them go looking for other information elsewhere, and usually end up on the internet. As we know, there's great information and then there's not so good information on the internet. So how do we help channel them to the right sources that has been validated and is up to date? when we talk about that cultural and sensitive source of information, it's really around the fact that people learn in many different ways. And some of that is cultural. It's dependent on where you live or the experiences that you had being raised. But it's also just around the way that your mind works and the best way that it is for you to learn. So, having information available in multiple formats, so it's not just written, but perhaps video. For some people, it's even a combination of the two, or other kinds of mechanisms to help them absorb that information and put it into that context that for them is easy to understand. Now, that's not always an easy thing to do, especially from a hospital or a clinic, but there are so many resources out there that really, I think it's just gathering them together and making sure patients are pointed to the right information to help them.
Another problem study showed that 1/3 of the patients refuse CAR T-cell therapy when they offer it. What are the main concern patients express, and how can this be better addressed by the advocates and healthcare professionals?
Yeah, the thing about CAR T is it's unusual. It's a different kind of treatment that patients are not used to. It's a little space age, right? That your cells are going to get taken and they're going to get modified and then re-injected in. And so for some patients, that whole thought of that's what's going to happen can be a little intimidating. At the same point in time, the side effect profile potentially of what you might experience with CAR T can also be frightening. Cytokine release syndrome sounds scary. So does neurotoxicity. And so for patients, really, it's making sure they have excellent information on, one, the possibility of those things happening, what steps now are taken in clinic to mitigate the risk, because now the way that we treat patients now in clinic is very different than what happened originally in clinical trials. Doctors have become much, much more proficient about handling those side effects early so they don't become problematic for most patients, as well as making sure patients have good information on understanding what those symptoms look like and when they need to seek extra help so that they can feel prepared to face these if they do become part of their experience. So I think really it's a combination of those things, being scared of the concept as well as scared of those side effects. I will say as well that we seem to have an issue perhaps with patient-doctor communication when they're describing CAR T. What often happens is doctors present this as a last chance scenario, like we don't know what we're going to do if this doesn't work. And that can raise the fear of a patient and their caregiver quite significantly. And so, maybe looking at different wording when we're talking about CAR T, it's not, even though it's still fairly new, it's not that new in the treatment landscape anymore. It's been around for a while. We have lots of good validated data around it, but there are also other options for patients if this particular therapy doesn't work. And so I think, the way that doctors are talking about it and presenting it in the clinic can actually help create some of those issues as well. One of the things we're looking at within the CAR T vision is some of these issues. It's looking at how do we better equip doctors with the information that they need to be able to present this in a more realistic as well as with good scientifically validated information, and present it to the patient in a way that they will understand it. Also connecting some of those dots with multi-stakeholder formats about how you can also integrate patient advocacy, patient organizations into a patient's care on top of what you're getting within the clinic from your doctors and nurses and other people on the medical team. So if we make this more rounded and more holistic, we do think that patients will be less fearful about potentially choosing this option. I will say again, though, what's most important is patients are actually told about the therapy and given the option so they can act on it.
From your engagement with the global advocacy groups, do you see meaningful difference in the access challenge between the North America and Europe, where the gaps most acutely affect the patients?
There are definitely gaps. There are very much differences, not just between North America and Europe, but even within Europe, within certain parts of North America. It's not something that is easy to define and say this is only, an issue here versus there, because there are multiple issues that are happening. I think, for some, it's very much financial issues, whether that means that a public healthcare system hasn't yet added it to a formulary, or whether an individual patient is negotiating with their insurance company about how to access this treatment. As well, we do see some issues with having enough CAR T clinics to be able to treat a patient effectively so that they can connect in the time that they have before their disease advances even more. So there are some staffing or just, physical clinic locations. That's an issue in some areas. So really when we're, within the CAR T vision, when we're looking forward, this is definitely an area that's being examined. How do we increase some of that capacity? And at the same point in time, see if there are other ways we can think about for dealing with the financial impact of CAR T, whether that's with a healthcare system or whether that's with individual patients. I do think this is one key area where it's important that there's joint initiatives that include both patient advocates, patient organizations, as well as clinicians, and also having those deep dive discussions with regulators and payers about the value that CAR T brings. The difference it's making. We're actually having patients cured in the lymphoma space that not that long ago would have had zero options and would have unfortunately passed away. So when we have this opportunity to actually bring them a cure, we should be figuring out a way to make that happen.
Early referrals is critical, yet many patients are referred too late. How can patient advocacy groups help make sure patients are identified and referred earlier, especially in the local cancer clinic?
We do a global patient survey every 2 years, and within that, we analyze a lot of different data sets. And so we've looked actually at the experience of patients with relapsed refractory diffuse large B-cell, which is one of the indications for CAR T. And so we know with those patients, they're very activated actually. At this point in their experience, they're more likely to spend even more time investigating the options and the information about what treatments are available to them. And so we do have cases of patients that are bringing the concept of CAR T to their doctors instead of vice versa. But this takes a very activated patient, someone who's really willing to invest that time and effort. And so, as well as having the doctors raise this as a possibility in clinic, it's like, how do we get more of these patients ready to do that themselves? We know that comes with good information and good information sources that they can find quite quickly. And so, for us at Lymphoma Coalition, one of the things that we're doing where there are new clinical practice guidelines coming out in Europe is we're creating patient-friendly guidelines that also have hints within that for patients of steps that they can take themselves to raise a treatment option with their doctor if it isn't raised by the doctor. And it may be that they don't have, they're not eligible. Definitely that happens. But I think what's happening sometimes in clinic is doctors are making a decision for the patient on which treatment might be best with them based on what they see, but without having a good discussion with the patient. So, they may not have an obvious care partner, as in they don't have a spouse, but they might have a great friend or somebody from their church who's willing to step up and be that care partner. And so really making sure that good conversations are happening and the patient gets all of their options presented to them. If it's not going to happen with the doctor presenting them, that the patient feels energized and confident enough to raise them themselves.
What action are needed to ensure that patient voice is not only heard, but meaningfully integrated into the future CAR T cell therapy access and policy decisions?
One of the things I love about the CAR T vision is that it is actually a group of different stakeholders coming together, everybody with an equal voice, And even though we're working with clinicians and policy people and others that are specialized in HTA, et cetera, nobody at that table treats anybody else any differently. And in fact, when we make comments coming from the patient perspective, that is not only valued, but we have people asking more questions or validating what they're hearing to make sure that the patient voice is properly integrated in how we move forward. And this is a perfect example of how these discussions should be happening. I will say from patient advocacy in general, many of us have been working in advocacy and policy for a very long time and oftentimes have more experience doing this than clinicians do. And so we can bring that experience into these conversations. At the same point in time, we have that patient voice. Some of us, like me and our organization, we have data that can come into the conversation and prove really that for patients at this point in time in their patient journey, they're not only looking for a treatment that is effective and given them extra years, they're also very focused on the quality of life. And so, when we look at patients that have had CAR-T and are surviving, many of them are doing so and able to live their life quite fully. And those are important factors that need to be definitely raised and brought into that equation, and making sure that everybody's voices are treated with the credibility and the respect for the knowledge that we have into these equations. I do think there's hope for CAR-T. I do think that we'll be able to make some advances because of projects like the Vision. And I do anticipate that we will get more patients into CAR-T in the near future. So, I have a lot of hope because of the way this project has worked forward and the mutual respect that exists within the table that's been working on this project thus far.
Thank you very much. I have finished my questions, but I don't know, do you want to add something more or underline any point in this interview?
I do have one thing to say, and this is to clinicians. Don't make assumptions that you really know your patient and you understand the impact of their disease on their quality of life. There's a good chance you don't have a good picture. And the reason is even though these people have disease that's progressing, at the same point in time, life is changing behind the scenes. And so their priorities have often changed about what they expect from their care and expect from how to manage their disease and the impacts that they're willing to tolerate moving forward. You only have that type of information if you're having good, honest discussions with your patients. And oftentimes you need to add that extra question in at the end of visits when you've covered everything that's important to you, and ask your patient, what's really bothering you that we haven't discussed this far? And listening and having those kinds of insights come directly to the patients to make sure the treatment choices that you may be presenting to the patient really reflect their need. You don't know. Maybe they're quite happy to travel a distance, and maybe they're not. And maybe they're willing to give up work for a short period of time to have something like CAR-T, and maybe not. But you don't know unless you're actually having these types of conversations. Either way, let's make sure that the treatment recommendations that get to our patients are really the best fit for them and the life that they intend to live right now.
Thank you so much. It was great pleasure to have you today.
Well, thank you for letting me be here. I appreciate it.